a new nerve today. The nerve which I would like to discuss today is oculomotor nerve. So oculomotor nerve, it is the third cranial nerve. If you see, this oculomotor nerve is purely motor nerve, and it, as the name says, it is a motor nerve, so it will move the eye. So it supplies most of the parts of the eye. Now it starts from midbrain. Okay, it starts from the midbrain. It has two main components. One are the general visceral fibers, and the other, okay, it has two components. The first component is general somatic efferents. General somatic efferents, as the name implies, these general somatic efferents, these will supply the muscles of eye, except all the muscles of eye except lateral rectus and superior oblique. Now the second group is, the second group of fibers is general visceral afferents. These general visceral afferents, these are parasympathetic fibers, and these will uh, give pupillary reflex. These will supply the supply sphincter pupillae. These will supply sphincter pupillae and ciliary muscles. So first let us learn about the course of this oculomotor nerve. This oculomotor nerve, if you see, it takes its origin from the midbrain. Okay, so let me draw the midbrain first. Just a minute. Okay, in the midbrain there is substantia nigra. So this is the dark substance which is called as substantia nigra. This is the cerebral aqueduct which is present in the midbrain. Okay, and these are the nuclei, red nuclei of the midbrain. Okay, now let me draw the oculomotor nerve. The oculomotor nerve somatic component I will draw in the red, and visceral component in green, in blue. So first somatic component, there is an oculomotor nucleus. So oculomotor nucleus. So there is periaqueductal gray matter also. So I'll draw aqueduct a little smaller. Yeah, this is aqueduct, which I'll paint in blue. This is aqueduct. The area surrounding the aqueduct, which is in gray, this area is called as periaqueductal gray matter. This is called as periaqueductal gray matter, the matter which is around the aqueduct. Okay, now first I will draw the oculomotor nucleus. So in the periaqueductal gray matter, you will have two oculomotor nucleus. Okay, I'll draw only the nerve of one side. So these oculomotor nerve, it arises from the this oculomotor nuclei which is present. This oculomotor nuclei is present on the medial aspect of cerebral peduncle of midbrain. And then once it is in the medial aspect of cerebral aqueduct. So let me draw the other view. Okay, this is one view. I'll draw even the other view so that we will understand the next course. Okay, so in the other view I will draw. So this think that this is the cerebrum. Okay, now this is the midbrain, pons, medulla. So this is the back side. So you have two interpeduncular sulcus, and this is the peduncular fossa. Okay, interpeduncular fossa, two peduncles. There are two peduncles and also interpeduncular fossa. So the oculomotor nucleus which is there, that is arising here. Okay, and then it runs to the back of the midbrain, and then okay, then it will enter the interpeduncular fossa. So from here it will enter the interpeduncular fossa and runs. So it will enter the interpeduncular fossa and then it runs forwards like this. This is the interpeduncular fossa and it runs forward like this. So if you have to see here, it is arising from here, then it will run in the it will run downwards, okay, like this. And then it will enter the interpeduncular fossa. This is the interpeduncular fossa. These are the two peduncles. It is running in the interpeduncular fossa and then it is coming out. Okay, and then it runs forwards like this. Okay, now once it has entered forwards, now it will cross two arteries. Okay, one artery. I have drawn it with red color, so I have to draw arteries with other color, right? So this is one artery and this is the second artery. Okay, so what are these arteries? These, it crosses two arteries and they are called as number one, superior cerebellar artery. So this artery is called as superior cerebellar artery and this artery is called as posterior, okay, cerebral artery. This artery which is there, this is called a superior cerebellar artery. This artery is posterior cerebral artery. So now this oculomotor nerve, it crosses this both arteries, superior cerebellar arteries and also posterior cerebral arteries, and then it also passes lateral to the posterior communicating arteries, and then it will cross through the tentoral notch of the tentorum cerebelli to enter the middle cranial fossa. So if you see, this is the posterior clinoid process. Okay, this is the posterior clinoid process, and here we have the tentorum cerebelli structure. So what this artery does is, this artery will pierce forwards. This is not a correct anatomical picture, this is just for us to know. Okay, and then it pierces the tentorum cerebelli, tentoral notch of tentoral cerebelli, and then it will enter the middle cranial fossa. Now it has entered the middle cranial fossa. In the middle cranial fossa, it pierces the dura mater in the oculomotor triangle. Now in the, this is the middle cranial fossa. Okay, so let me just name it. So this is tentoral cerebelli. So it has pierced the tentorum cerebelli and then now it has entered the middle cranial fossa. Now from the middle cranial fossa, now it will again pierce the dura and it will enter the oculomotor triangle, which is lying in between the free margins of tentorum cerebelli in the roof of the cavernous sinus. Now it will pierce one more dura in the middle cranial fossa itself and it will enter into a triangle which is called as oculomotor triangle. Okay, now I'll name it later. Okay, now once it has entered the oculomotor triangle, then it will this oculomotor triangle is in the roof of the cavernous sinus, right? So just a minute, it is like this. Think that now oculomotor triangle, now cavernous sinus, this is the cavernous sinus. Okay, now this think this will enter the cavernous sinus. Now it enters the lateral wall of the cavernous sinus, not the posterior wall. It is in the roof, but it will enter the lateral wall of the cavernous sinus. Okay, now this will reach the lateral wall of the cavernous sinus. So think that this is the lateral wall. So this is the lateral wall of cavernous sinus. And then once it has reached the cavernous sinus, then it will now, in the cavernous sinus, in the anterior part, it will divide into two divisions. One is upper division and the lower division. Okay, now in the cavernous sinus it divides into two divisions, upper division and lower division. The two divisions will enter the oblique orbit. Now it has crossed the cavernous sinus, and then from here there it enters the orbit by superior orbital fissure. So this is superior orbital fissure. So in this, from the superior orbital fissure, these two divisions which are there, they are entering the orbit. So in the orbit, the smaller upper division will pass above the optic nerve on the inner surface of the superior rectus. So this will supply the superior rectus. Let me just draw an eyeball so that it becomes easier. Okay, this is the eyeball and this is the optic nerve. Okay, now it will supply the superior rectus here. Okay, now and then passes through the superior rectus and supplies levator palpebrae superioris. Okay, it will supply the superior rectus and also it will pass upwards and it will supply levator palpebrae superioris. Whereas the in larger interior division of oculomotor nerve, it passes below the optic nerve, and now it gives three branches, one to the medial rectus, the other to the lateral rectus. Okay, this is the medial side, so one to the medial rectus, other to the lateral rectus, whereas the next one to the inferior rectus. The nerve to the inferior rectus gives a parasympathetic motor route to the ciliary ganglion located in the posterior part of the orbit. So this will give a route to the ciliary ganglion. So this is the ciliary ganglion located in the root of the orbit. This is presympathetic fibers. What does these these are presympathetic fibers. Now the postsympathetic fibers which are there, they will supply the ciliary muscles of the eye. Okay, so this is about the oculomotor nerve. Now let me just name them. So I have named everything. So if you see this is about the oculomotor nucleus. I forgot, and I have even named this oculomotor, sorry, these nerves. Just a minute. I'll just rub it. Okay, all these will not come here because these are the parasympathetic fibers, right? I did not tell about the parasympathetic nerve supply, but the superior division, if you see, it supplies the levator palpebrae superioris, whereas the and it also supplies the superior rectus. Inferior division, it will supply medial rectus and inferior rectus and also inferior oblique. Okay, not the lateral rectus, sorry, that's a correction. And then if you see, from here there is superior cerebellar artery and then superior cerebral artery. So this oculomotor nucleus, so from the oculomotor nucleus it will reach the cerebral fossa, and from there it will cross the superior cerebellar artery and posterior cerebral artery, and then it will enter the uh, it will cross the tentorum cerebelli and enter the middle cranial fossa. In the middle cranial fossa it crosses the dura and also oculomotor triangle, and then it enters the cavernous sinus. So from there it will reach superior orbital fissure, and then it will reach the superior division. It will divide into two divisions in the orbit, that is superior division and inferior division. So what is this called? This is orbit, right? This part is orbit. In the orbit, it divides into superior division and inferior division. Superior division gives rise to levator palpebrae superioris and superior rectus, whereas inferior division gives branches to medial rectus, inferior rectus, and inferior oblique. Now what about the parasympathetic supply? Parasympathetic supply, we have a nucleus which is called as Edinger-Westphal nucleus. So this is the Edinger-Westphal nucleus, which I will draw here. Okay, it is also present in the periaqueductal gray matter. Now this Edinger-Westphal nucleus, this will also same pathway of the optic nerve. Okay, it will cross the superior cerebellar artery and posterior cerebral artery, and then it will enter the middle cranial fossa by passing the tentorum cerebelli, and then it will cross the dura, and then it will enter the oculomotor triangle, and from there it will cross the cavernous sinus, and then it will enter the cavernous sinus, and from there it will exit, and it will reach the superior orbital fissure, and from there, with the fibers of the inferior oblique, okay, with the fibers, now with the fibers of inferior oblique, it will gives to the ciliary ganglion. Okay, let me again draw this down. Okay, I think you understood it. So now in the inferior division, so it will go from the inferior division, and then it will go through the inferior oblique muscle, and from there it will, I'm just extending it so that I can write. Okay, and from there it will give branch to the it will it will give to the ciliary ganglion, and from the ciliary ganglion, this ciliary ganglion, it will supply to ciliary muscle and also to the constrictor pupillae. The pupil only for the constrictor pupillae, not for the dilator pupillae. So this is the parasympathetic fibers from Edinger-Westphal nucleus. So this is about the oculomotor nerve course. Thank you guys for watching my lecture. In my next class, I will explain about the lesions of the oculomotor nerve. Thank you for watching my lecture. Thank you.